Hey y'all, my name is Daisy.
I'm Kaylee.
And I'm Jasmine.
And today we're going to be presenting theory of transpersonal caring, which is Gene Watson's theory.
Gene Watson is the theorist that we have chose, and Dr. Gene Watson was born on June 10, 1940 in West Virginia. She graduated nursing school at 21 at Lewis Gale School of Nursing. Dr. Gene Watson is a distinguished professor and dean of the University of Colorado Denver College of Nursing Medical Center campus. And some fun facts about her: she was the youngest of 7 children, which contributed to why she wanted to become a nurse.
All right, Jean's theory, the theory of transpersonal caring. According to her book, her theory, the goal of nursing is to help persons attain a higher level of harmony within the mind, body, and spirit. The goal is pursued through transpersonal caring, guided by creative factors and corresponding curative process. Her theory is based on 10 curative factors.
The first 10 curative processes is first, practice of loving kindness and equanimity for oneself and others, which just means you need to love yourself and you need to love others as well. Being authentically present, enabling and sustaining the deep belief system and subjective life world of self in the one being cared for. The third one is cultivating one's own spiritual practices, going beyond the ego self, deepening of self-awareness. So in order to practice correctly, you need to be self-aware. And then we have developing and sustaining a helping, trusting, authentic, caring relationship. The last one, or the fifth one, is being present to and supportive of the expression of positive and negative feelings as a connection with the deeper spirit of oneself and the one being cared for. So you don't need to just recognize your positive attributes, but also your negative.
Okay, so the last 5 of the 10 curative process is creatively using oneself in all ways of knowing as part of the caring process and engagement in the artistry of caring healing practices. The 7th one is engaging in a genuine teaching learning experience within the context of a caring relationship while attending to the whole person and subjective meaning, attempting to stay with the other's frame of reference, which I believe and take this as when you are tending to a patient and being with them, it's more so like you need to teach them and help them feel better, with also having a caring relationship with them. Number 8 is creating a healing environment at all levels, subtle environment of energy and consciousness, whereby wholeness, beauty, comfort, dignity, and peace are potentiated. Number 9 is assisting with basic needs with an intentional caring consciousness, administering human or care essential, which potentiate alignment of the mind, body, spirit, wholeness, and unity of being in all aspects of care, attending to both embodied spirit and evolving emergence. And the last one is opening and attending to spiritual, mysterious, and unknown existential dimensions of life, death, suffering, allowing for a miracle.
Its application to nursing practice. Gene Watson's theory is applied to nursing practice daily. Watson's theory is based on her 10 curativs, which means to cherish, to appreciate, and to give special attention. One of her first theories, according to the book, is practice of loving kindness and equanimity for oneself and others. Nurses each and every day apply this curative of being loving, kind, and having an equanimity of themselves every single shift. We truly believe that Watson's theory should be applied to nursing practice by all nurses.
In a clinical situation, there is a patient who just underwent a major surgery and is currently facing some troubles mentally. As a nurse, not only do you need to check for vitals and any complications from surgery, you need to be caring and loving to the patient. You can ask if they need anything, talk to them, and provide extra care. So her theory is just Nursing is not just about doing, and making sure they feel better, not only physically, but also mentally, and being there for them, because sometimes you are their only support system.
And I also take this clinical situation as surgery is a lot, and surgery takes a lot away from people sometimes. So some people aren't able to handle it as easier as others. So there may be a patient that you come across that has mental problems taking how the surgery went, or it could have went bad, it could have went good. And as a nurse, you need to be there for them lovingly while also take care of them.
All right, how does this theory compare to our philosophy of nursing? All right, so Gene Watson's theory of transpersonal caring is similar to my philosophy of nursing in many ways. In my philosophy of nursing, I believe that having a good connection and a relationship with your patients is very important. Similarly, Gene Watson's theory really focuses on these aspects of care.
Okay, my philosophy also correlates with Jean Watson's philosophy. Her theory is similar to my theory, but is also different. My philosophy and belief in nursing is to be caring, promote health, and build a relationship with the patient. In my philosophy of nursing, I find it important to be there for the patient in every single way. Watson agrees with me on this. She harps about being there for your patients, but she is also a big believer in deepening your spirit and finding yourself to care for other people. While I do think you should have a sense of self, it is important when treating people. I do not think it is the most important thing in nursing. I think that you need to put your patients before you put yourself.
Mm-hmm. And for my philosophy of nursing aligns with the theory presented by Dr. Gene Watson. According to the book, Watson uses the term caritas to describe the theory. Caritas means to cherish, to appreciate, and to give special attention. I believe to be a nurse, you have to be compassionate, caring, and understanding, and Watson's theories exemplifies those values given. So a little bit more on my philosophy is that it aligns with this. I believe that you have to be compassionate and caring, and I really like how Watson goes more into depth with the 10 caritas as to why this makes sense with her theory.
And then these are resources. Most of the information we got was from the textbook. Once again, I'm Daisy.
I'm Kaylee.
And I'm Jasmine.